Let's talk about something that can send a jolt of panic through any parent, a fever in your child. We're going to cut through the noise and the worry. Instead of fear, we're going to give you the facts, a clear head, and a solid plan of action, all based on what the experts say.
You know that exact moment, right? You put your hand on your child's forehead, you feel that intense heat, and your mind just starts racing. Is this serious? What do I do? It's a feeling every single parent knows. So let's dive in and really separate the facts from the fear. Okay, first things first. We have to completely reframe how we think about a fever. For a lot of us, that word alone is enough to cause some serious anxiety. But the goal here isn't to see the fever as the bad guy. It's to understand what it's actually trying to tell us.
And here's the single most important thing to get your head around. A fever isn't the sickness. It's actually a good thing. It means your child's immune system is kicking into gear, it's working hard, and it's fighting off whatever bug has decided to show up. It's a sign that their body is doing exactly what it's supposed to do.
So what's the immune system fighting? Well, it could be any number of things, really. We're talking about all the usual suspects from childhood, viral stuff like a cold or the flu, or maybe bacterial infections like strep throat or an ear infection. It could even be a stomach bug. The fever is the big obvious symptom, but finding the root cause is what really counts. All right, this brings us to what is probably the most critical part of this whole explainer. Knowing what a fever is helps calm you down, but knowing when to act is what truly puts you in control. Think of this next part as your clear, simple action plan.
And that's really the heart of it, isn't it? When you have a clear checklist, that anxiety turns into action. So let's go through the specific signs that tell you, okay, it's time to pick up the phone and get a doctor's opinion.
Okay, let's break this down step by step. First up, a high fever. We're talking about a temperature that's above 39 degrees Celsius, which is about 102.2 Fahrenheit. Next, and this is a big one, look for major changes in behavior. Are they way more sleepy than usual, super irritable, or just seem really weak? That's a huge sign. Third, check for dehydration. If they're flat out refusing to drink anything, that is a red flag. Then, pay close attention to their breathing. Is it really fast, or does it seem like they're working hard to breathe? Also, keep an eye out for other alarming symptoms. Something like a seizure or a strange new rash means you need to call immediately. And finally, you're looking at the clock. If that fever is still hanging around after 48 hours with no signs of getting better, it's time to make the call. So, you've checked the list, you've made the call, and you're on your way to the doctor. Let's pull back the curtain on what actually happens there. Honestly, just knowing what to expect can make the whole thing so much less stressful for you and your little one. A doctor's visit usually follows a pretty logical path. It'll start with them just talking to you, getting the whole story, what the symptoms are, when they started, all of it. Then comes the physical exam, a complete head-to-toe checkup. From there, they might decide they need a bit more info, maybe from some lab tests to really nail down the cause. And then, the most important part, you'll leave with a super clear treatment plan that covers any medicine they might need and exactly what to do at home. And that brings us right back to you and your absolutely essential role in all of this. Once you've got a diagnosis and a plan, the spotlight is back on you and the simple, comforting care you can provide at home to help your kiddo get back on their feet. At home, your job is all about some simple but really powerful things. Rest is absolutely number one. The body just heals best when it's resting. Just as important are fluids. You have to keep pushing them to stay hydrated. And here's a crucial point. Only use medicines to reduce the fever if your doctor has specifically recommended it. And of course, good old-fashioned hand washing and hygiene will help stop the germs from making the rounds through the whole family.
Okay, I want to do a quick lightning round now. Let's tackle a few of the most common questions that always come up when you're dealing with a sick child. We're going to get you some fast, clear answers. This has to be the number one question on every parent's mind. You just want your child to feel better fast. And antibiotics can seem like a magic bullet. But are they always the right tool for the job? The answer here is a huge it depends, and it's so important to understand why. It all comes down to what's causing the infection. See, viral infections like the common cold or the flu, they just don't care about antibiotics at all. They have to run their course. But bacterial infections like strep throat or some ear infections, they often do need antibiotics. And that's exactly why getting a proper diagnosis from a doctor is so key. It makes sure your kid gets the right treatment and helps us all avoid using antibiotics when they won't work. Okay, let's just tackle the big one head on. We've talked about when to call the doctor,
But what's that line? When does a fever cross over from just being a normal sign of sickness to something truly dangerous?
So the answer isn't just a number on the thermometer. Though, yeah, anything over 39 Celsius is definitely a cause for concern. A fever really becomes dangerous when it's paired with those other major warning signs we talked about. Things like trouble breathing, a seizure, or that extreme sleepiness or weakness. You have to look at the whole picture, not just the temperature. This is another thing that can drive you crazy with worry, right? You've seen the doctor, you're following the plan, and now you're just waiting. What's a normal timeline for seeing some improvement? For a lot of these common childhood bugs, you should start to see your child turning a corner within a few days. But the real key here is to just keep paying close attention. If things aren't getting better or if they seem to be getting worse, you should never hesitate to follow up with your doctor. I really want to leave you with this reassuring thought from the experts. Fevers and infections, they're just a part of being a kid. It's totally unavoidable. They feel really scary when you're in the middle of it, but it's so important to remember that with good information and getting help when you need it, our kids are incredibly resilient. They bounce back quickly and safely. So now you have a checklist. You have the facts, you have a plan. But what's the single most powerful tool you have in your toolkit? It's your own intuition. You know your child better than anyone else on the planet. So take all this knowledge and combine it with what your gut is telling you. That combination, that is your ultimate guide to getting through these moments with confidence.